Let's now talk about the stomach channel, the primary channel. The stomach channel starts from the lateral side of the Alanasi at Li20. It ascends along the nose and meets the bladder channel at bladder 1. It then enters the upper gums. It curves around the lips and links with the directing vessel at REN24. It then runs along the lower jaw and ascends in front of the ear to reach the forehead. From stomach 5, a branch goes down to the throat and the supraclavicular fossa. It then passes through the diaphragm, enters the stomach and the spleen. From the supraclavicular fossa, a branch follows the superficial channel down to the breast and abdomen to pass through stomach 30. Another branch from the stomach connects with the point stomach 30. From this point, it follows the superficial channel to run along the anterior aspect of the upper leg and the anterior border of the tibia to end at the second toe. A branch from stomach 42 links with the spleen channel. Overview of stomach points. Affect leg, abdomen, chest, throat, and face. Treat the limbs and painful obstruction syndrome. Treat all abdominal symptoms. Strengthen chi and blood and resistance to pathogenic factors. Resolve phlegm. Treat problems of the face and sinuses. So let us now review or discuss in more detail the very complex pathway of the stomach. The stomach primary channel begins with an internal branch at the yang axis connection of the first great circuit, Yang Ming hand-foot pairing at Li20, lateral to the Alanasi, then travels internally to bladder 1 at the inner canthus of the eye, emerges at the infraorbital ridge at stomach 1, the beginning of the external part of the primary channel. Then it descends laterally along the nose and enters the gums of the upper jaw. Meets the contralateral stomach primary channel and the tumai at 226 and emerges again. Curves around the lips to meet the renmai and again the contralateral stomach channel at REN24. Traverses the lower cheek and winds around the lower angle of the mandible. Here at stomach 5, the external channel divides into 2 branches. One branch ascends anterior to the ear, travels via gallbladder 3, gallbladder 6, gallbladder 5, and gallbladder 4 to the temporal region, to stomach 8, and continues to the forehead to meet DU24, where it terminates. The other external branch descends along the lateral aspect of the neck to the supraclavicular fossa and travels posteriorly over the back of the neck to DU14, below the spinous process of the 7th cervical vertebra, where it meets the other 5 yang primary channels. An internal branch descends from the supraclavicular fossa, passes the diaphragm, enters first its pertaining fu organ, the stomach way, and then connects with its paired zang organ, the spleen. Minor branches of the internal channel intersect with REN13, REN12, and REN10. The internal branch then descends towards the inguinal region, where it emerges slightly superior to stomach 30 and reconnects with the external branch. The external channel descends from the supraclavicular fossa, crosses the nipple, and laterally passes the umbilicus, travels in a curve to the leg and knee, continues along the anterior crest of the tibia and dorsum of the foot, and terminates on the second toe at stomach 45 at the lateral corner of the nail. An internal branch originates below the knee area at stomach 36 and travels to the lateral aspect of the middle toe. A further branch separates from the primary channel at stomach 42 on the dorsum of the foot and connects at spleen 1 with its paired spleen channel on the medial aspect of the big toe. This is the foot yin-yang connection of the first great circuit. Clinical importance. Exterior Piao signs and symptoms: high fever, malaria, flushed face, sweating, confused mental state, dry lips and mouth, lesions of the lips and mouth, sore and swollen throat, thoracic pain, red and swollen legs. Interior or Zangfu organ signs and symptoms. We have abdominal distension, sensation of fullness, edema, irritability during work and rest, mania and epilepsy, hyperpepsinia, constant hunger, yellow urine. Excess will have heat sensations on the anterior aspect of the body, constant hunger, and yellow urine. And then for deficiency symptoms, we have cold sensations on the anterior aspect of the body, chills, stomach cold with distension and fullness. Connections and meeting points of the stomach primary channel. So with the spleen primary channel, connection is foot yin-yang connection of the first great circuit. Location, stomach 42 to spleen 1 on the foot. Circulation, circadian, according to the organ clock. Importance, exterior-interior relationship. With the large intestine primary channel, connection is paired according to the 6-channel theory, the hand-foot pairing, Yang-Ming, yang axis of the first great circuit. Location, Li20 to bladder 1 to stomach 1 on the head. Circulation is circadian according to the organ clock. Importance, above-below relationship. Connections with other Zangfu organs, stomach and spleen.